President Biden is already beginning a new era of trying to tackle the coronavirus pandemic here in the U.S. Beyond just mandating masks on federal lands and in federal buildings, the president also signaling the re-inclusion of the U.S. in the World Health Organization there, as well as making good, or at least starting to make good, on his promise to deliver 100 million vaccine doses to Americans within his first 100 days. For more on those efforts and perhaps a shift away from what was being done under the Trump administration, I want to bring on our guest today. Dr. Jessica Osterman is emergency medicine physician in Los Angeles. And Dr. Osterman, appreciate you coming on here. Obviously, California right now is a key hotspot in what we're seeing play out as cases continue to rise in the U.S. But I'm curious to get your take on maybe what you're seeing through those first executive actions from President Biden in a way that it might signal a very serious shift to tackle the pandemic here in 2021.
Yeah, I think I speak for a lot of my colleagues when I say that we're very excited to see a coordinated federal effort moving forward to kind of regulate distribution of vaccines, testing across the country, as well as some strategies to reopen schools and businesses. And I think we've all really been in search of sort of a coordinated federal effort that can trickle down to the state level. So I'm really excited to see what Biden's done today.
There's been a lot of confusion around vaccine rollouts across the country, particularly in California, though. Gavin Newsom a few weeks ago saying that, look, hold me accountable for administering those 1 million doses initially. Now there's reports that because of some technical issues, it's hard to track how many actually got those vaccines too. Can you speak a little more to what's happening on the ground there? Do you have any more visibility on what the availability of the vaccine is in the state?
Yeah, I do think at least in LA County, the rollout of vaccines has been a little slower than we expected. I think we are at a good level at this point in getting our healthcare providers vaccinated. But I think kind of that 1B rollout has been a little bit delayed because the healthcare vaccination strategy has taken a little longer than expected. But I'm hoping, as I say, with a more coordinated effort from both the national and the state level, we can really get back on track and start rolling out these vaccinations at a higher speed to get the population vaccinated and safe from this coronavirus pandemic.
Yeah, and to Zach's point that he made earlier, California, certainly Los Angeles County specifically, has really been the epicenter of this pandemic or this most recent surge. There's been a lot of talk here about the new variant that was found in this state. How much of that do you think contributed to really what was those deadly numbers that we saw back in December that seemed to finally be tapering off just a little?
Yeah, I'll tell you from my clinical standpoint, I think that the variants that we are seeing circulating around the population now are quite different and more infectious than what we were seeing at the beginning of the pandemic. We're seeing a lot of younger, healthier people that are much sicker than they were back in March and April when this all started. And as you guys have seen the numbers, probably they're saying that about 1 in 3 Los Angelinos are infected with coronavirus at some point. So whatever is out here is definitely spreading faster.
Yeah, and just kind of looking ahead here to what you were talking about in the federal response, coordinated federal response. It was interesting to see Pfizer tell a number of news outlets today that they would be open to coordinating with specific states in rolling that out. Of course, that's something that in New York, Governor Andrew Cuomo had been pushing for. When it comes to maybe that shift, though, there are a lot of people in the medical community that look back to kind of what happened with ventilators and how that became what some people described as an eBay, with all states competing to get those in limited supply. Is that a concern as a doctor that might be out there when you think about the rush to get all these vaccines to Americans?
Yeah, absolutely. I do think that when you put it on individual states to reach out and try to obtain these vaccines and distribute them, you are dealing with inequalities based on individual state governments, individual health departments. And so I do think that there needs to be something, at least from the federal level, that states can then implement. But I think there needs to be a federal strategy first for obtaining these vaccination doses and then distribute to the states equally.
And Doctor, just going back to what you're seeing on the ground there, how have things shifted over the last week. If you look at the numbers specifically, it feels like there's at least a leveling off. The numbers are still high in terms of case counts, hospitalizations, and deaths. But what are you seeing in your hospital?
Yeah, we are seeing the number of patients total coming in going down. I think people are actually taking this seriously now, given how infectious this current surge is. And they are staying home. They're not coming to the ER for things like medication refills and for medical complaints they've had for a long period of time. But we are still seeing mostly coronavirus patients come in, and we are very overloaded in the hospital in terms of ICU beds. As I mentioned before, a lot of these patients are much sicker, requiring ventilators and ICU level care, and we just don't have that capacity in the hospitals that I'm working at. So a lot of those patients are continuing to board in the ER, which is really just backing up the whole system.
Well, I mean, the idea of maybe potentially cases finally leveling off would be very welcome and very good news for everyone here. One of the other key positive, I guess, silver linings from all of this, with people wearing masks and social distancing, that caught my eye, was the drop in flu cases, which is kind of shocking when you look at that in where we are in this pandemic, comparing this year to years past. Cases are shockingly low, almost at zero here. I'd be curious to get your take on that, doctor, as maybe being, one of the positives to come from this is people might in the future, if we have to get vaccines and booster shots here, tying it to coronavirus might actually increase the idea of Americans going out there and getting flu vaccines.
Yeah, absolutely. I think as healthcare providers, we were all kind of dreading this winter because of the convergence of the potential flu cases and COVID cases. But at my hospital, actually, we haven't had one flu positive uh, report from our
Wow.
lab, which is really shocking, and fantastic to see, because it does show that having flu shots, wearing masks, washing your hands, and generally taking those public health measures really do make a big difference. And if we could see the flu decrease like this every winter, I would be thrilled.
Yeah, it's nice to at least end on a positive note on that front. Dr. Jessica Osterman, emergency medicine physician in LA. It's good to talk to you today.
Thanks so much.